Hello, my name is April Souza. Today I'll be presenting on reimagining mandated services for reunification as part of a child welfare policy analysis. In this presentation, we'll explore the policy issue of family reunification, current data, federal and state policy approaches, values and assumptions behind the system, what's working and what's not, barriers to success, recommendations for change, and how advocacy, including social work advocacy, can make a difference. Reunification is the intended goal for most children in foster care. However, research shows that nearly 50% of children in care have clinically significant behavioral issues. Little follow up occurs to monitor and manage these behaviors after reunification, which often sets children up for failure, especially regarding their mental and emotional health. We disproportionately see poor outcomes post reunification. Children often return to impoverished and segregated neighborhoods with higher parental incarceration rates and distrust of child welfare systems. Um, Black youth, in particular, who reunify, experience the highest incarceration rates among children foster care exit outcomes. And national data shows that between 20 to 40% of children re-enter the foster care system within 5 years of reunification. Over half of youth who re-enter describe the experience as isolating and re-traumatizing. In one study, 17 out of 20 reunified parents reported adjustment challenges. And these parents face many barriers, including fear of losing their child again, that prevents them from voicing concerns, lack of mental health support, employment and childcare instability, and these delays and disruptions in public benefits. These stressors increase the risk of foster care reentry. On a federal level, under the Family First Prevention Services Act of 2018, um, funds can be used for prevention services like mental health care, substance abuse treatment, and in home parenting support, um, while allowing up for 15 months of time limited post reunification services. Um, these are optional and not mandated, while Massachusetts does offer more programs than the majority of states, including family incentive reunification and stabilization teams that provide short term intensive support to prevent re entry, as well as the Family Reunification Support Program that offers parenting education, supervised visits, transportation, and advocacy through weekly meetings. Through my research, I've come to realize that our system in the United States is grounded in key values that consist of child safety must come first, evidence based services should guide interventions, families are the best place for children when they are able to be safe in their home, and time is of the essence to minimize harm from instability. While these values are important, they often ignore um, individuals' complex situations and put more of a blanket approach. These values can be seen in the parts of the system that is working that allow for state flexibility under FFPSA that allows for tailored interventions for unique communities and situations, as well as preventive services, although these services can be limited. They do recognize the importance of prevention, and that goes for limited post reunification support. Uh, the they recognize the issue um, although it is still limited. While there are some areas where they are doing things in a good way, there are major challenges throughout the reunification system. And these systems often over rely on checklists rather than checking for true behavioral change. If a family is able to check all the boxes, they are considered fit for unification when that may not always be the case, and vice versa. A family may not check all the boxes but has done immense growth. Also, the FFPSA participation varies a lot by state. While Massachusetts has certain programs, many states do not. And these, among all states, the post reunification services remain being largely optional, which can be difficult because some families who have been involved in the system may not want to opt in to more involvement with the system, even though it could benefit them in the long term. Additionally, racial and economic disparities persist where marginalized families are overrepresented in the foster care system, as well as these families rarely have a voice in service planning. And this leads to unaddressed needs, lower engagement, and less effective reunification. My policy recommendations may be simple, but they are urgent and would be impactful. I believe that there should be mandated um, and funded comprehensive post reunification services nationwide um, through on a federal level, and this could be done through amendments to the Title 4E and Title 4B. And these amendments would reduce reentry rates, address racial and economic disparities, improve child and family well-being, and the funding would include parenting coaching, mental health and substance abuse services, housing stabilization, and school advocacy. Although my policy recommendation may seem straightforward, there are many potential barriers to implementation, and like states facing tight budgets and resisting new mandates because that's not where they feel they should allocate their funds, as well as political resistance, where state government may feel that mandating certain things is expanding federal oversight. Additionally, the child welfare workers may feel they have a new set of cases with not enough staff or resources to implement change, causing for delays in services as well as quality of services. And although these barriers are political, structural, and financial, um, they're not impossible to overcome. There are currently many organizations that are working towards breaking down these barriers and advocating for family reunification policies. Two in particular are the Children's Defense Fund and the Family Focused Treatment Association, which advocate for systemic reform and family centered services. And social workers on the micro, meso, and macro level can also advocate for reform by partnering with national organizations, improving their own agencies' practices, and empower the families that they work with, um, both before and after reunification. Thank you so much for watching my presentation on reimagining mandated services for reunification as part of a child welfare policy analysis. My references will be on the next 2 pages. Thank you again.